She's just amazing. Welcome to the Great Reboot. I'm Tori Ryden. Courage. We're hearing and we're seeing it every day on the front lines. Doctors, nurses, CNAs, housekeeping crews who clean and clean and clean, all of them working very hard, a lot of hours to keep COVID-19 at bay. It is a tough battle. Dr. David Redding is a nephrologist, a kidney doctor. He works at Maine General Hospital. He's been working on the hospital floor with critically ill patients, and he's also trying to save his business, Good Fire Brewing. We'll talk about that in a moment. First, I just want to welcome you, Dr. Redding. David, how are things going, and how's the battle going right now in your hospital?
Hi, Tori. Thank you so much for bringing attention to all the people that are working so hard. I'd say there's challenges everywhere, and obviously the hospitals are sort of considered the front line. Here in Maine, I think we've been watching a slow wave come at us for several weeks, and there's been a lot of anxiety just in the preparations, and we're starting to finally see a lot of presentation of the disease. And so that has, brought the intangible to the very real very quickly. I think that the medical staff is holding up remarkably well, although concerns about supplies and the uncertain nature of the future is ripe for for worry and for a lot of anxiety. But I'm really proud of our community here. They seem to be taking everything with a stride, and certainly working so much harder to make sure that we are as stringent and limiting the spread of this disease as best we can.
As a nephrologist, you're working with kidney patients who kind of can't take a break from the dialysis machine. I mean, that's something that has to continue. It's not like they can say, hit a pause button, say, oh, well, we'll see you after this is over. How are you handling your own patients, and what does that all look like?
So it's really interesting. I think that the companies that run dialysis are private, and so they tend to move things a little bit faster. And I think with the help of the government reimbursement schedule, we've been able to focus more on telehealth. And I think that's like truly, the safer option for those patients who are immunosuppressed just by the nature of their disease. They're also naturally in close contact with one another 3 times a week or more. The flip side to that is that the dialysis nurses and physicians and the techs and the people that care for those units and staff are so in tune with sanitation, sterilizing their instruments. It couldn't really get better in terms of the preparation on that side of things. But I would say that the biggest thing that I've noticed has been utilizing technology to make this as safe as possible. It makes logical sense, and it may have sort of pushed things forward into the future a little bit just by nature of necessity. So.
Governor Andrew Cuomo down in New York referred to what's going on, particularly down there, as a hurricane. And I'm wondering, if that were to happen in Maine and in other states, do you feel that, first of all, would you have to jump in, not as a nephrologist, but would you be on the front lines in a different way? And do you think Maine is prepared and ready for that?
I know that the governor and our hospital administrations are working as hard as they can to secure supplies and come up with protocols. I mean, I know that my bosses directly in my department just have nonstop emails and communication about how best to make a new game plan almost every day, and so maybe sometimes several times a day. I think the best way that the state can be prepared and that we can support the healthcare workers in the system is to take social distancing deadly serious. we have an opportunity here where we're, maybe a week and a half behind places like New York City. And if we really take our precautions seriously, we can prevent the surge from being as dramatic. So I'm hopeful that by taking these things seriously, and by, the participation of all of our citizens, that we can get through this. This will end, and it's going to be bad. It's just a question of how much can we mitigate that consequence, and we have real power to do that. And I'm seeing it every day, around town. I'm really proud of the way that my hospital has tightened its protocols and securities. I'm really proud of the way our brewery has paid so much attention. And naturally, when you're a manufacturing producer, you're going to focus on those things to begin with. But for us, it was like, all right, how do we close all those moments when our product could be exposed and make it as safe as possible? And that's been
let's share that a little bit with people, because
sure.
let's share the story, your story. You're right now trying to save your business, Good Fire Brewing. You opened in June 2017. You've got a bunch of people who are working for you. You're in the Portland area, in the Bayside area of the city. And I know that, what you've done is, as you look at maybe you can tell us a little bit more about your product, but that you really rely on quality, as you were just mentioning, but also I was reading on your website that you go for kind of a lower alcohol content, and it's really all about using different ingredients that, I stay away from gluten, but you said that I could drink your beer because you use different products that probably would not bother me. So I'd love to hear a little bit more about why you started Good Fire Brewing, and then we can kind of get into what you're looking at this point.
Sure. Just to clarify a few things. One, our beer has plenty of gluten. I wonder sometimes if purchasing higher quality milled barley or malted barley rather from certain suppliers in the United States, and certainly a lot of European suppliers, where the rules regarding the treatment of the grain are so much more stringent regarding chemicals. This would be an unfounded claim, and I'm super sensitive to that being a position. So I just want to be clear. But I
appreciate your clarification. Thank you.
I've had several friends and colleagues mention to me that they have some gluten sensitivity, but they tend to have less problem with our beer. But I as someone who doesn't suffer from that at all, I can't speak to it. But certainly let me know. Give feedback. Data is always good to us scientists. With respect to our beer, we love low alcohol beer. I think some of our higher alcohol offerings tend to sell really well, and we're doing right now what we can to basically support the needs of the community. I think that probably some people aren't looking for low alcohol alternatives right now as they're hanging out at home. But those are the beers that we like to make the most. We make a good range of things, I think, from dark beers to light beers. IPA is certainly our strong suit. But I would say German style pilsners and Kolsch is something that is almost like the brewer's delight these days. It's something that when we drop off beers to our fellow brewers, we drop off sort of the lighter German styles, as a throwback to maybe the more classics styles of brewing.
When you started Good Fire, I was reading that you carefully put together a team of science-minded people, which is really interesting. I mean, definitely you're being a doctor and you're starting your own brewery. You don't see that every day. And the fact that you have kind of had a science background lineup, tell me a little bit about that and the people who are on your team.
Sure. So for the team itself, I'm a board certified nephrologist, and the kidneys do a lot to balance your acid and base, your pH basically in your body. Brewing chemistry has a lot to do with acid-base buffers. And so that is sort of what I zeroed in on, and I would say water chemistry, and that part of the process were a big part of what I focused on when I was home brewing. In terms of like-minded science folks, our canning, our head packager is an engineer and worked in a power plant. And so he's obviously really excellent with standard operating procedures. If we trust him to work on power plants, then I trust him to run my canning line. Our head brewer is someone who's completely self-trained and self-taught, but his intellectual curiosity is so deep, and our conversations always moved more towards the data-driven, the evidence-based, and I think we sought out to sort of challenge some maybe older notions about how beer should be made. I think especially craft beer and beer in general was made more towards the shelf stable, as opposed to something that could be consumed fresh. And that's really what we focus on. Obviously, we want our product to last as long as possible, and we go to great lengths for that. But I would say our forte is into creating something a bit more nuanced, and certainly we're not the only ones doing that, but it's been a joy.
You, when you launched in 2017, you could not have possibly seen this coronavirus COVID-19 coming down the pike in just 3 years. This has forced you, the show is all about, rebooting, reinventing, kind of shifting things. What are you guys doing now? You've got this company and now you had to pivot. So what has been your pivot?
Sure. And I think that's a really important thing to mention. I want to, give my sincerest thanks to all the people that have made sacrifices for our company to exist. We had to lay off employees. It was the hardest thing that I've ever done. I know that I don't even have it as bad as other breweries and restaurants around town who are laying off tens of employees, if not 100 employees at a time. I know that I've seen tears. I've seen, just a lot of sadness around that. Right now, we are trying to tread water, and we realize that that's been at the expense of those individuals, and we're hoping that we can keep the company afloat so that they can come back to jobs. And when we do come back, I feel pretty confident that the cabin fever effect will be significant, and we're going to have a lot of people coming out and spreading joy and supporting these businesses. We hear about it all the time. Our pivot has been towards to-go contact-free customer exchanges with our beer. So not only have we taken heightened internal precautions, so any employee with symptoms went home on a paid leave before the CARE Act was passed. We have been in contact with the Maine CDC almost every week to make sure that we are upholding all of our big highest standards. And then I think it's been really hard for us to transition away from that, the tasting room experience, because that was half of what we've been doing, is creating a destination and making people feel really special when they come in. We're not just, here's a glass of beer. We want to talk to you about it. We want to find out who you are, where you're coming from, what your story is. And so to go to, a place where now it's like, all right, maintain 6 feet, wear a mask, wear gloves. We're using a sanitation spray that is, basically a food grade acid that, basically all the cases get baptized in that before they go to our customers. We're super sensitive about our interactions with them. If the trunk door opens up, and they're paid, we just leave it, and that's that. And I think that's the best thing that we can do right now, because it abides by our best instincts regarding social distancing. But it also supports part of our business and will hopefully allow us to tread water until we can come back. And I think it also gives a little bit of hope to our customers, a little bit of creature comfort to the people that have to stay at home and miss being out in the world and sharing a beer with their loved ones.
It must just be such a kind of a strange juxtaposition for you to be such an essential worker, being a doctor, being on the front lines, and then having your passion project is considered a non-essential, and keeping that afloat, because that just to help so many people who are working there, that's just got to be a weird feeling to be fighting kind of in two different battles right now.
Yeah, I think I had a couple sleepless nights, and then I just channeled the part of me that got me here in the first place, which was, there's no time to implode here. Everybody's just got to rise, and I would say my wife and I had a lot of things to work out. She's a healthcare provider as well, and the thing that we're struggling with the most is having two little kids and deciding what's the safest thing for them in all of this. And so right now we're battling about whether, it's a safe move to basically to drive them down to my parents and have them stay until this blows over. So that, when you're just dealing with such high level issues, it does also put things in perspective. And I feel like, some of the trivial anxieties that I've had over the last 6 months have suddenly melted away. And now it's just, focus on getting through this, being safe, being kind to one another, not losing hope, galvanizing us all together towards one thing, making sure that we're not divided by our worries or by stress. And certainly this can bring out the worst of us, but it can also bring out the best of us. And I think we need to focus on that. That's the only thing I can say, is just try and keep your head high. And I say to my patients all the time, try not to let the turkeys get you down. I think that's a good old dad joke or dad reference.
It's a tough time. I don't know how you do it. I wonder how couples manage who are both in healthcare. Hard to leave it behind and not bring it home and talk about it. Hard to shut out the noise of all of it. How do you do that?
Well, our home is like a sanctuary. We've essentially, cut off any people that come into our home except for the one direct care provider for our children. We have a quarantine zone in our basement. And so, I think this is, again, sort of the luxury of isolation for people that are, middle class or upper middle class, is that we have a home that we can create a quarantine space in. And so we come into our root cellar, our boots are sprayed off, our clothes come completely off and go into a designated laundry basket that goes directly into the washing machine. We don't touch our kids or talk to them before we go into the shower. We shower down completely. I mean, that's a little excessive, but we're in a high risk zone every day, and more than likely encountering respiratory particles that contain someone's viruses. So we've got to go to those measures, but that allows us then that once we're clean and in our home, we feel like we're in that sanctuary, and then we try our best to leave that behind for our children so that they're not growing up in a world of anxiety. We certainly have had conversations like, what would be the closest thing that's analogous to this? Would it be growing up during World War II, or during one of these things where you sort of have like a national crisis or international crisis that binds people together? I have a lot of patients that are older, so I have the luxury of asking them, so what was it like when schools were closed for polio and things like that? And they all have a resounding message of hope that like people will bond together and get through this. I think when things are new and uncertain, that's when things are the most dangerous and the hardest for us to sort of to deal with. But I mean, we're human beings. We will rise.
What do you want people to know? You've already said, please practice, the physical social distancing. Is there anything else that you think people need to do right now? I know we're all probably going to be wearing face masks just going outside.
Mm-hmm.
What would help you as a physician?
I think just the kindness piece. I mean, we're seeing a lot of people thanking healthcare workers, which, I've always said to service members, like, thank you for your service. Both my grandparents were in the Navy. And so it's interesting to hear someone say, like, thank you for your service. I just never have thought about it that way, in the same sort of vein as that public service. So I think it's really wonderful for everyone here. I think especially like nurses and housekeeping and techs and respiratory therapists and the rest of the people that make them security workers at the hospital. I think grocery clerks need to hear it. Thank you for being out there and getting us through this, because that's got to be really hard. Also, I took an oath. I don't really have a choice. Like, I have to. This is what I, resigned myself to do. I don't think that the Whole Foods checkout guy did. So, probably like a little bit of kindness and empathy towards everyone in every situation would go a long way. That would make me feel better.
It's funny, NPR put out, I have a cartoon, and we'll show it up here, and it's of healthcare workers, and it says, our new Olympians, healthcare workers. And, you are. So thank you.
It's to answer another question that you made earlier. I don't know what's going to happen in terms of what I'm going to be asked to do. So I feel like today I'm just doing my normal job. But if I am asked to do something in another capacity, of course I would. It's hard to hear about some physicians who are having trouble finding housing in places of need. That was an article that I read today that was really astounding to me. Yeah, because I think that most doctors, when they hear about the medical draft, you get a little lump in your throat, but you're like, okay, if that's what we need to do to get our people through this with as little death and unnecessary suffering as possible, then we'll do what we have to do.
Well, David, I can't thank you enough for joining us. I know you're busy. You're there at the hospital right now at Maine General, and you've got so much on your plate, but you're really level-headed about all of this, and I hope you'll consider coming back on and keeping us updated on things. And you are a credit to the state of Maine, and I'm sure the governor appreciates all that you're doing and your attitude and all of your patients as well. So thank you so much. And Good Fire Brewing, all the best with that as well.
We will keep our heads high and keep swinging. Thank you for asking all these thoughtful questions. I think you really have a good sense of what's going on out there and what the concerns are. So we appreciate you drawing the attention to that. And I'll just throw a shout out, to all my colleagues, all the nurses, all the staff that clean rooms and make appointments and make this happen. Thank you all. Keep your heads up.